Hey, good morning and welcome to UroPatient. I'm your host, Vic Senese. If you're watching this live, you see us every Saturday at 10:30 a.m. live on YouTube, LinkedIn, Facebook, X. And we got a new one for you, Kick. I joined Kick to try that one out. So more options to find out information about your bladder. Now, if this is your first time checking us out, especially you Kick people, go to our website at UroPatient.com to learn more about us and the show. Best place to go to watch past episodes. And there's a whole bunch of them. This is episode 76. So 76 episodes you can watch. Also, we have these helpful handouts always for everything we talk about that you can download right from our website and use them however you want. Hey, today's going to be about Botox. I had somebody write in about the procedure. They had questions, and I thought, I really got into a good patient explanation about what to expect with Botox. So here it is. Welcome, everyone. No, you haven't wandered into a Beverly Hills med spa. This is the bladder kind of Botox. Sorry, we won't be fixing crow's feet today, but we're going to help calm your cranky bladder. Bladder Botox might sound like your bladder is getting a spa day, and in a way, it kind of is. Instead of smoothing out wrinkles, this Botox chills out your bladder muscles so it stops acting like a drama queen with a constant "I have to pee now" emergencies. It's perfect for folks with overactive or neurogenic bladders who've tried pills that didn't work or do the trick. A urology provider uses a tiny camera to inject the Botox right into your bladder wall. Now, bladder Botox is for those poor souls whose bladders seem to have a mind of their own, constantly shouting, "Bathroom, now!" even when it's totally inconvenient, like during movies, meetings, middle of the night. So it's especially helpful for people with overactive bladder. You may have heard the term OAB. That stands for overactive bladder. So for those people who haven't had luck with medications, for those with the neurogenic bladder and conditions like multiple sclerosis or spinal cord injuries, basically if your bladder's behaving like an overcaffeinated toddler, jumping around, refusing to calm down and make messes, bladder Botox might just be the babysitter you've been looking for. Now, Botox works by putting your bladder nerves on a temporary timeout. Keyword, temporary. This stuff does not last forever. Good side is that if there's a problem, it doesn't last forever. Normally, these nerves get a little too enthusiastic and tell your bladder to squeeze when it's actually not full. It's kind of like the car alarm going off in your car for no good reason. It doesn't really know why. I always say like that check engine light. It goes on and maybe there's nothing wrong with the car. So your bladder's going off saying, "I got to go to the bathroom," and you really don't. Botox steps in like the bladder bouncer, blocking those nerve signals that cause those sudden gotta go urges. It relaxes the bladder muscle just enough to reduce leaks and give you more control without turning your bladder into a lazy slacker. So too much could make your bladder not want to work at all. So it's kind of a fine art of how much Botox to put in. You want enough to kind of get it to not be too overactive, but not to the point that it can't work. Now, the results usually kick in within about a week or two and can last several months. I've actually seen cases where it's lasted a year. Typically, it's about 6 months. It's like giving your bladder that much-needed vacation for overreacting. Now, bladder Botox procedure is surprisingly quick and drama-free. Definitely less stress than you'd probably expect. Now, when I'm saying quick, this whole procedure, the actual Botox part of it, less than 5 minutes. There's some prep time ahead of time. We do like to give you some anesthetic, and that takes a little time to work. But again, it's very short periods of time. Usually done right in the urology office with a little numbing medicine or local anesthetic to keep things comfy. Using a thin tube called a cystoscope, basically a fancy bladder camera, your provider will gently guide a tiny needle, really tiny, into the bladder and make several small Botox injections. The whole thing, as I said, takes about 5 minutes. The whole procedure, 15 to 30 minutes. Shorter than an episode of your favorite show, and you're usually in and out the same day. Absolutely in and out the same day. You might feel a little weird peeing afterwards for a day or two, but most folks handle it like champs. So let's go ahead and look at a video on this. This is the scope that's used. It's a flexible scope, very normal size for your urethral opening. You can see we drain the bladder to start with a little catheter. And then we laced the scope inside. and look in there, and we can fill the bladder with a little bit of fluid. Prior to doing this, we put some anesthetic into the bladder and let that kind of sit in there to help numb the walls of the bladder down. So you can see there the doc's looking through the scope, and that's kind of what it looks like from their side, from inside. We do it with a camera so we can see this. It's a two-person job. The doctor is now putting the needle through the scope, so you really won't feel that. It's going through the scope. And yeah, that skinny wire is actually an injecting needle. We'll show you how that looks. So as you see it coming now, we can see it coming into view. And it's really a tiny little needle. And we're going to be injecting that right into the bladder. And here's the other end. You can see where we hook up the Botox in that syringe. And as I said, we do this as a two-person, myself and the doc normally doing them. So the doctor's going to find the spot he wants to inject, and then I'm going to squeeze whatever amount he wants to put in there. Sometimes it's a half a cc, sometimes it's 1 cc. Each guy has their own preference for what works best for them. So there you can go. You can see he put the needle through the wall. Again, you're not going to really feel any of this because it's pretty numb, and you can kind of see it blubbing up a little bit as that gets injected there. That was one injection. Now he goes on to the next spot. We do this as a series of injections, like I said, 10, sometimes 20. A lot of the guys have been doing this now in 10 and using a more concentrated amount. There you can see that little bleb. That'll go away. It's going to look normal. So what happens after the procedure? Well, after your bladder gets its dose of Botox, you can go home that same day. You're going to go home probably within about a half hour having this whole thing done. Maybe just skip the gym today as kind of a precaution. You don't want to do too much overworking and heavy exercise or things like that. But most people feel fine afterwards, though you might notice a little bit of burning or spotting of blood when you pee for the next day or two. Now, the real magic kicks in, as I said, in about 7 to 14 days when your bladder starts behaving and those urgent bathroom dashes become a thing of the past. In some cases, your bladder might get a little too relaxed and not empty completely, so your provider will check to make sure that you're emptying your bladder completely. Sometimes a quick bladder scan or even a chat about catheters, don't panic, it's just in case, can be used. The effect typically lasts about 4 to 6 months, at which point your bladder might start acting up again, politely requesting another Botox appointment. And just a word about those catheters. So in the worst case scenario, if it gets too relaxed and it won't be able to drain itself, you may have to do intermittent catheterization. Little tiny tube. You can check out episodes. I've talked about how you catheterize yourself. It's a minor inconvenience. I've had a few patients that have had to do this, and I can tell you that most of them within a few weeks were able to go back to just normal urination and empty their bladder completely with the good effect that Botox has. Now, while bladder Botox can be a game changer, it's not all smooth sailing, and there are some few possible bumps along the way. Some people might find it harder to empty their bladder afterwards, as I mentioned, and may need to use a catheter temporarily. Others might experience more urinary tract infection symptoms like burning frequency, or you might even develop a urinary tract infection. Not impossible, especially if you were holding back a little more urine than you should. Again, a bit of blood in the urine. Mild discomfort during the procedure, and thankfully it's quick and done with numbing meds. Rarely does the Botox wander off and cause muscle weakness elsewhere, but that is a risk you're going to be signing a consent for. So don't worry about us. We're not trying to paralyze your smile. And most side effects are mild and go away on their own, but it's always good to talk them over with the provider before rolling out the red carpet for your bladder Botox debut. So who should not get bladder Botox? So if you're not willing to catheterize yourself if it's necessary, you shouldn't get Botox. Those with an active bladder infection, we're always going to check your urine before we go injecting it. We don't want to be sticking needles into infected urine in your bladder. Shouldn't have it. Just we'll treat the bladder infection, you'll come back. And if for some reason you're allergic to Botox, obviously you're not going to have it done. That would be bad. So some common questions. These are the top hits from the Bladder Botox FAQ hotline. Yes, I made that up, but you get the idea. One big question is whether it hurts. And the good news is the procedure, as I said, done with local numbing medicine. So it's more awkward than painful. So really don't expect big time pain. Patients are actually kind of surprised that they don't have more pain. Now, patients also wonder about how long it takes. And typically, start to finish, you should be able to be out of there in 30 minutes and off into your car and on your way. As I mentioned, the actual procedure itself, when the doctor gets in the room and does his thing, 5 minutes or less. And you can definitely go home afterwards. Yep, you walk in, get zapped, then head out. Common concerns include side effects like urinary tract infection, as I mentioned, or temporary difficulty urinating, maybe starting the urine, maybe not at all. But your provider will walk you through it all. And yes, the effects do wear off. They're not permanent. So repeat treatments are usually needed every 6 to 9 months to keep your bladder from going back to its drama-filled ways. One of the things I will tell you with my experience with patients, the results are usually so good that they're more than glad to come back. And they're going to be the ones that are going to start calling you and saying, hey, I'm noticing a difference. I need to get in. So bottom line, if your bladder's ruining your social life, your sleep, and your sanities, and meds just aren't cutting it, then yes, bladder Botox might be totally worth it. It's a quick outpatient procedure, no fancy hospital gowns required, and is relatively minimal downtime. It can give you months of sweet, sweet bladder peace. Sure, there's a tiny chance of side effects like trouble peeing or needing a catheter for a bit, but for many people, the freedom from bathroom sprints is well worth the trade-off. Think of it as a reset button for your overachieving bladder, finally letting you binge watch your favorite show without bladder-related plot twists. So the big takeaway from bladder Botox procedure, it's quicker and easier than you think. No need for a red carpet or Hollywood glam squad. It's typically done right in your urology provider's office with a local anesthetic or light sedation and takes less than an hour. Most people feel little or no pain, and there's no big recovery time, maybe just a day or two of taking it easy. The Botox starts working within a week or two, giving your bladder the chill pill it desperately needs. Just be prepared. You might need to self-catheterize temporarily if your bladder gets a little too relaxed. But overall, it's safe, effective way to tame a wild bladder and reclaim your bathroom independence. And remember, Botox isn't just for Hollywood anymore. It's helping bladders stay chill under pressure. Who knew your bladder could be more relaxed than you on a vacation? So join us again next week on UroPatient for more tips, laughs, and the latest in urology health.